Blog Talk Radio. Welcome to Medicaid Matters, the only live talk show about the business of Medicaid health care. And now, here's the host of Medicaid Matters, Richard Yaden.
And thank you, Braley, and welcome everyone. It is Tuesday, June 12th, and I'm Richard Yaden, President and CEO of Managed Medicaid Services, and your host for the next hour here on Medicaid Matters. Our topic for today's show is Medicaid fraud. Are we making any progress? And I know anybody that's been involved in the Medicaid business and the Medicaid community knows that Medicaid fraud is a problem. It's a real problem. It's a big problem, and something we're going to be hearing more and more about, but just what exactly is happening in the area of Medicaid fraud? What's being done about it? And what are some of the best ways to combat Medicaid fraud? And if we've got some good ideas, why isn't everyone doing those things? Well, if those questions are also on your mind, then you are in the right place. I'd like you to just join us here for the next hour. Settle back. We're going to explore those questions and their answers with today's guest, Mr. Alex Yeh, past president of the National Association of Medicaid Program Integrity and now a manager with Advanced Med Corporation. And Alex is going to join us here in just a couple of minutes. But since we are live, you, our listeners, and our viewers can also join us with your questions on this topic and with your comments. The phone lines are open now, and you can call 626-657-2125. That's 626-657-2125. You can speak with me or you can speak with Alex. We'd really like to hear your opinion or your comments on this subject. Perhaps you've got a thought that we haven't considered here on the air, and it'd be great if you could take some time and share that with us. If you can't call, we're also on Twitter. If you're signed into your Twitter account, you can send us a question or a comment to @MedicaidTalk. That's our Twitter handle, and we'll get them on the air as time permits. If you're over on MedicaidTalk.com and watching the show, you'll see that we have a new way for you to chat live with the show. So if you're listening or watching from that website, you'll see that chat feature over on the right side of the page. Join us there, and you can send us comments or questions that way, see what other people are saying as well. So be a part of the program. We have lots of different ways for you to be here. Unlike your typical webinar, unlike your typical business presentation, we have this as an interactive show. We also have a terrific summer scheduled for you. Guests from around the entire spectrum of the Medicaid business are going to be on our show, and later in the show I'll be talking about some of our upcoming guests this summer, and we also have a special announcement later in today's show, so stay with us. Well, our guest today, Mr. Alex Yeh, is an expert in Medicaid fraud and program integrity. As the past president of the National Association of Medicaid Program Integrity, he led an organization of state and federal officials from the 50 states whose primary task is to investigate instances of fraud and abuse in Medicaid medical assistance programs. Alex is a manager with Advanced Med, a healthcare program integrity company. I'll certainly let him take a minute here to tell you more about himself. But Alex, I want to welcome you to Medicaid Matters today.
Well, Richard, it's a pleasure to be able to have the opportunity to talk about Medicaid fraud and the latest, greatest in the Medicaid fraud world. It's definitely something that's very close and dear to my heart.
Well, we're very honored to have you on the show today. This is something that keeps coming up in almost every conference that we've been to. I know a lot of our viewers and listeners know that we do live remotes from a lot of conferences, and I know that Medicaid fraud and risk has also been part of it, but this is a topic that has been on multiple workshops on every conference agenda that we've been to. So I know we're gonna have a lot of people interested in what you have to say. But I thought before we get into the show, and I have been doing this, Alex, with every guest that we've had on since March because it's on the top of everybody's mind. You know, at the end of this month, we're going to hear an opinion from the Supreme Court that could have a tremendous impact on Medicaid. And without asking you, I'm not going to ask you to be a prognosticator and tell us what you think they're going to do. But let's assume that they decide that Medicaid is not going to be the element in the Affordable Care Act is not going to be upheld and is stricken from the act. What does that mean for Medicaid from what you're seeing, Alex?
Well, I think, from a state's perspective, when you look at it nationally, some of the requirements in the Affordable Care Act, they were definitely going to put a strain on many of the states' Medicaid budgets. Obviously, across the country, Medicaid budgets are perhaps in the third or fourth, or perhaps even the number one highest budget priority within the state. And by increasing the roles and the rules that apply to eligibility in the Medicaid program, it was going to open up the door to perhaps a much larger population than many states could possibly tackle at this point in time, given the fragility of the state's economic conditions. That's one of the leading causes of concern at a state level when you look at the Medicaid program. Without additional fundings for increasing eligibility, for example, the states must get more creative in how they look at that program. So to me, I know when I look at the Affordable Care Act, it put additional strains on the states. In other areas, it had to deal with provider enrollment issues, the qualifications of certain providers, the investigation of providers. And those two put together, when you push on a provider and then you increase those roles and then expect them to take on more Medicaid patients, it can create definitely a stress within the system. I know that, for example, the health insurance exchange requirements under the Affordable Care Act also put additional strains onto states. Those problems, as we see them growing exponentially across the states, definitely impacted what people perceive of the Affordable Care Act. Now, the Affordable Care Act also had some very good things within it, increasing awareness for Medicaid fraud and Medicare fraud, bringing programs into closer alliance with each other. All of those issues are very important in the Affordable Care Act, and I think it depends on how you look at the situation. And from a standpoint of a state Medicaid director, they've got to be able to balance all of those concerns with maintaining a quality of care for their patients, in the Medicaid arena, as well as being able to offer services on an ongoing basis, meeting the federal requirements for issuing those services. And I think when they look at those issues, again, across a much broader spectrum, it's that layer upon layer upon layer which the states have the greatest concern. And, of course, when the states have a greater concern, they're going to talk to their legislative leadership to try to deal with those issues. And I think what rolls out in June, an opinion from them will be a determination on whether or not there is any legality to the entire act or parts of the act. And from our perspective, in terms of program integrity, we like some of those aspects, and so it will be interesting to see if and how that decision will affect program integrity into the future. And time will tell very shortly here as to what direction many states will take in terms of the program. If it's upheld, obviously, it'll be a question of how are we going to pay for this, both at a state level and a federal level.
And that's probably why I think that's one of the reasons the states brought this suit, is the objection that they were kind of being coerced into having to shell out more and take on more people.
Oh yes,
yeah.
I mean that impact. Again, if you add 25% to a state's Medicaid rolls, the impact is much greater than just saying it's just simply numbers.
Mm-hmm.
It's the growth within the system that has to deal with taking care of those patients. And, oftentimes there's the argument that talks about Medicaid rates. Are they always the best rates? Are they the worst rates? Do providers shy away from Medicaid patients? Each of those equations has to be looked at in terms of its overall effect on the entire program.
Mm-hmm.
And, it depends on your states as well. Looking at, a small Medicaid state that has a much lower Medicaid budget, say $2 billion or less, versus some of our larger states, obviously California, New York, Florida, Texas, those areas where you see the greatest concentration and the largest number of Medicaid patients, that becomes a daunting task for the leaders of each of those states.
Mm-hmm. No question. Well, thanks for sharing those thoughts on that topic. We ought to jump into our subject today, which is Medicaid fraud. And let me start by asking you, Alex, what kind of fraud are we seeing in Medicaid today as perhaps being the most prevalent?
It's really hard depending on the location. We look at increasing areas of organized types of criminal activity in terms of when one thinks of criminal activity, we often think of Medicaid fraud. And when you ask what fraud is, of course, it is based on an intent to do something. And that intent is often the most difficult things to prosecute. But with that, you see areas where, you have the standard or more traditional types of Medicaid fraud, which is creating ghost billings, for folks that don't even exist. Upcoding, of course, is one of the more traditional ones. And then you see a surge of different types of criminal activities that have to deal with building a base, or what I call a pool of recipient numbers and IDs because of ID theft, from which you can sell those records, and then you can create a whole array for different service areas. For example, if you have an aged population, you can look at those services which are really high to bill, and then you've got those types of organizations which are using those bills to look at durable medical equipment, always a big area. As states look at these issues, one of their concerns is, am I going to see this type of organized criminal activity in my state? And I'm not talking just about like organized crime, but I'm talking about health care fraud in general as it becomes more organized. The traditional thought amongst many states is that it's just merely a slap on the hand if you commit one of these health care crimes, and the punishment is not severe enough. So it's easy to go in there and say, am I going to risk a slap in the hand for several $1 million, and that temptation gets greater as you move into different and larger programs. So,
I can imagine. There's a lot of talk about this in the industry, and we're seeing more of it in the news. Just if you could very, kind of in a few sentences, quantify the size of Medicaid fraud, what would that look like?
From my perspective and looking at a national perspective, it's really hard to just say there is a certain percentage that is actually what you would consider fraud. We've heard numbers as high as 10%. We've heard numbers as 3%, 2%, 1%. I tend to look at it as a perspective for geographical areas within the country. Depending on where you're located at and depending on your concentration of providers, you may see fraud in a 3% range, a 2.5% range, and then you may see lower than 1% based on the certain geographical regions, because it's much harder for a provider to commit fraud and then to hide in those areas. For example, Wyoming, it's much more difficult to hide out there than it is to say in a large metropolitan area like New York City or South Florida in the Dade County area.
Yeah, no question. All right, well, sorry about that blast of music there, Alex. but that means we're about ready to move on to take a break here for a couple of minutes, and we're going to get back to this talk. I'm going to get more into just really the scope of the problem and how people are beginning to deal with this and what they're trying to do and trying to accomplish as far as getting through this. Fraud is a big issue, and it is something that's going to be with us, but there are some things that we can do to attack it. There's some things that are going on that are being put in place in various companies to attack it, and we're going to talk about those in just a minute. But first, we're going to stop here for a message from our sponsors, and when we come back, we're going to talk more about the details of this initiative. So stay with us, and more from Alex Yeh.
Nurses who want to stay on top of their skills know that the Nursing Informatics Learning Center is the place to go. You'll find articles, tutorials, a blog, e-zine, board-approved CE credits, links, assessments, and consultant services, all available to the global nursing community in one place. If you're a nurse or if your organization employs nurses, you need to visit the Nursing Informatics Learning Center.
By providing access to the care they need and the quality they deserve, Medicaid health plans enhance health outcomes of our nation's underserved. Listen to this letter to a Medicaid health plan that helped save the life of Juan, a 4-year-old with a rare heart disease.
All of your efforts have created a miracle for my son. Even though he was so close to death, you helped. You made a difference. Now he's coming along, little by little, step by step.
Medicaid Health Plans of America, ensuring access to better health care. Learn more at mhpa.org.
Elevating the quality of care with less cost. Today, that's the job of every Medicaid managed care company, but it can't be business as usual. Companies have to coordinate care a different way. The solution is Managed Medicaid Services. Through our virtual case manager network, our teams of Medicaid assessment specialists, and our new Advanced Care Transitions program, companies can dramatically raise the quality of care without increasing their cost. Visit us today at MedicaidServices.net. Managed Medicaid Services, your best source for innovative care management.
And welcome back to Medicaid Matters. Is the only live and interactive talk show about the business of Medicaid healthcare. We're looking for distribution partners for our show to help spread the word, and by joining us, you can increase traffic to your website, provide high-value content and entertainment to your members, customers, to your clients, and to the public, and demonstrate your commitment to the Medicaid community. It's very easy to become a partner. Just go to MedicaidTalk.com, click on the Contact Us part at the bottom of the page, and let us know about your interest. We'll show you how you can add a Medicaid Matters player to any web page or blog. Anyone can click and listen to that for relevant, interesting, and entertaining content within a matter of really just a few minutes. Your organization will be part of the Medicaid Talk community. If you're on the MedicaidTalk.com page right now, go ahead and send us a message so you can become one of our partners. I also want to let you know in 2 weeks, we're going to be talking with Karen Dale, Executive Vice President of Strategic Health Solutions at the DC Chartered Health Plan. It's part of our 2012 summer schedule. We also have guests from Gunderson Lutheran Health Systems and Health and Human Services from the state of South Carolina that are going to be part of our show. So make plans to join us for our slate of shows this summer. You can also find that schedule right there on the MedicaidTalk.com page. Well, today we're diving into the issue of Medicaid fraud with our guest and who is a Medicaid fraud expert and Medicaid program integrity expert, Alex Yeh. Alex, we were talking about the scope of the problem before we went to the break there, and I was wondering if maybe you could compare this to the size of fraud that goes on in Medicare or even in private health insurance.
Well, there's been an old adage that says if it's occurring in Medicaid or Medicare, it's occurring in the other programs. And again, if it's occurring in these two programs, it's obviously going to probably and most likely be occurring in our private health plans as well. Most providers are linked through multiple different programs. So usually when you have a Medicaid provider, they're going to be a Medicare provider as well. Mm-hmm. So, from our perspective in terms of the states, and when you look at it as a national level, you understand that, in talking with the private health insurance plans as well, that fraud is still prevalent out there, and it is still a concern, as well as any types of waste or abuse in a payment system such as ours. So, yes, it is definitely out there. It still exists. And I think that type of cooperation is an area of growth in terms of dealing with healthcare in general in the country. Mm-hmm. There definitely needs to be a better pathway for communication with all of these agencies, as well as the health plans. I think it's a golden opportunity for the health plans in the United States to reach out to these. To the government programs as well, and vice versa. I think it's a two-way street because I see that level of cooperation is such a necessary piece to the Medicaid fraud puzzle.
Yeah, I believe it. We have a couple of questions that are coming in through our chat line that I wanted to bring to you. I think they're kind of interesting, and I'd like to hear your response to them. First of all, Jeremy is asking us who in the market does the best job of fighting fraud.
That's a tough question. There's definitely a lot of folks out there in the industry right now, and it's one that's growing rapidly across the country. I don't think it's necessarily just one organization that does it better than another organization. Again, I see the need for cooperation when you're looking at this. So you may have a small company that has developed some algorithms in which you can run data through. And you may have another company that has a better delivery system for applying those analytics across the broad spectrum, including being able to match data from multiple program types. I think that type of cooperation is really what we're going to see as a cornerstone for combating fraud in these programs in the future. I think it's a necessary part of the equation that may not have been addressed fully by any one party, but I definitely see this in the future where this type of alignment or an ability for other companies to join with each other to come up with better ways of determining what type of analytics do we need in there to determine, to look at that data. Again, most fraud is developed from some type of data review process, and the states, that's where it's going to begin, because you've got to look at that claims data to determine whether or not there is a question or an issue that needs to be investigated.
Mm-hmm. Well, let me ask you, whose responsibility is it to police Medicaid fraud?
Yeah, again, looking at a national perspective, I say it's everyone's perspective, from taxpayers to provider groups, to the government, to state and local governments that handle their Medicaid programs, to the agencies dealing with those services, the ones that even do education out there for provider groups. It really is. When you talk about program integrity, you talk about Medicaid fraud, you are specifically talking about the responsibility of everybody, because it is a huge tax liability to all Americans and to everybody that is receiving services to keep a vigilant eye out for issues that may impact the level of care they receive. For example, if there is a lot of fraud going out there, and that money has to be taken back and it's going to impact their programs, those beneficiaries that are receiving services should be vigilant, such as we see the development of the Medicare, the Senior Patrol product out there that basically says, help us help this program, and to ensure that we're going to have a program that will take care of our seniors from now and until the future, because we know that that type of service is a delicate area right now. It's very costly. When you talk about Medicare programs, you're talking about a lot of money. The two programs together, in just a few years, are going to exceed $1 trillion a year. And, that is an extremely large amount of money into these programs. Yeah. I would like to see, states working together to develop a more progressive approach to dealing with the border states that they have in terms of Medicaid patients going across borders to receive services or duplicate services. That type of allegiance is very important in the states' areas, because it's one area that can help them monitor their beneficiaries in a more efficient and effective manner.
Yeah, I remember here in Tennessee, TennCare was kind of was a program that had a lot of publicity about it, and I remember one of the early problems we had is we had, not only do we have a lot of dead people that were on the rolls, but we also had people from neighboring states that were getting a lot of services.
And you see that across the board. You ask yourself, talking to states, how come we can't do a better job if we know that we have in our states death reporting systems in our vital statistics areas within many Department of Health arenas? Why isn't there a more related approach to handling that death information so the Medicaid agencies and Medicare agencies have a better access to that information? It is an odd thing when you ask somebody, do you check to see if you're paying for dead people? And, the most common response you see is, well, of course we do. But, if you go into any Medicaid program across the country, you will see dollars that are being spent on folks that have passed on. And it's a question that you ask, how can we improve our analytics to know that? Well, again, we are looking to technology in the future to take care of these. Better systems within states. We know when we look at Medicaid systems, the old, quote, legacy systems that were out there that were developed in the 70s, under very old programming guidelines within COBOL-type programmings. We know that they have their weaknesses, but many states are faced with budget problems where they simply cannot afford new claim systems or the new analytic systems that are out there for determining aberrant billing practices. When you look at a cost of a new system and you ask a state that they're going to have to provide some funding for that, it's usually the remark that you get is, well, is our system currently working? Well, you'll hear them say, yeah, it does work, but it doesn't work as well as it should. And they'll go, well, we'll put that on a priority list. So you have that definite issue where you know that technology can help in many areas. And that's just one small area that's open for that.
Well, it's the issue of having deceased people on the rolls. I don't think that's necessarily an issue of fraud. I mean, correct me if it is. I think it's more of an issue, as you were saying, of analytics and not having the right resources. Wouldn't you agree?
Yes. It only becomes a matter of fraud if somebody is intentionally doing, searching the rolls, creating new Medicaid IDs for people that have passed on, and then, using billing systems to auto-bill the programs. Then those issues become a little problematic.
Yeah, no question. Well, we're going to take another short break here for just a couple of minutes, and after this break, we're going to talk about some of the best practices that are being employed around the country to combat Medicaid fraud. Also have some more questions coming in from our listeners on our chat service. So if you're not there yet, go on over to MedicaidTalk.com and get involved. You can chat a question to us or opinion or some thought, and we can get it on. You can also call us at our number, which is, unbelievably, it escapes me, 626-657-2125, just give us a call. We'd be happy to hear from you. And we'll be back in just a few minutes.
Medicaid Matters is now booking guests. Who are we looking for? We're looking for people who can bring a fresh and unique perspective to the business of Medicaid health care. Do you have an idea that is unique, innovative, maybe even controversial? We want to hear from you. Go to MedicaidTalk.com, complete our guest questionnaire, and we'll be in touch with you to schedule an upcoming episode. Be a part of Medicaid Talk.
The Medicaid landscape is changing fast, and that means challenges, but it also means opportunity. Opportunity for you. And that's why you need to visit MedicaidJobs.net. MedicaidJobs.net is the place to showcase your talent to Medicaid companies, search for jobs, research the latest career trends, and register for the free Career Optimizer service. Don't wait. Go to MedicaidJobs.net today.
You're listening to Medicaid Matters on the blogtalkradio.com network.
And now over 5,000 listeners strong, Medicaid Matters can bring your company's message to the widest Medicaid business office at a audience at a very effective cost format. If you'd like to learn more about being a sponsor, then email us at info@medicaidservices.net, or you can call us at 615-257-1627. Well, I promised you a big announcement at the top of the show, so let me tell you a little bit about what we have planned. We just got this put together this past week, and Medicaid Matters will be broadcasting live from the Medicaid Enterprise Systems Conference, August 19th through 22nd in Boston, Massachusetts. All right, you can stop. It's embarrassing. You can stop. We're going to be there. Don't worry about it. This is a conference that is formally known as the MMIS Conference. It is the conference for MMIS, bringing together thought leaders from the public and private sectors to share ideas and information that is related to Medicaid systems and initiatives, something we were just talking about with Alex a moment ago. If you're going to go there and you're going to be a part of that conference, please let us know. We'd like to say hello and say thanks for listening and meet you personally while we're there, so be sure to drop by our broadcast booth. Well, let's continue our conversation with Alex Yeh about Medicaid fraud and program integrity. Alex, I know that Title 19 and Title 18 of the United States Code is the primary source of legal action for Medicaid fraud, or maybe I should say against Medicaid fraud. It might be good if you could brief our listeners on the differences between these two statutes and what they do in terms of fighting fraud.
Well, when we look at Medicare and Medicaid, we definitely look at the two different titles. Medicaid itself came out of Title 19 as a result of the amendment to the Social Security Act, and that was sponsored by legislation back in the mid-'60s. Specifically, we think of the war on poverty and in Johnson's administration. With the passage of Title 19, we have the birth of the entitlement program known as Medicaid. And that was a program that was created under a partnership with both states and the federal government to create a safety net for low-income citizens that did not otherwise have appropriate access to health care. And that, of course, is an aging system, and the policies that guide Medicaid under Title 19 probably need some revision as well. Title 18, when we look at it, we think of Social Security, obviously, and we go back many, many years ago, and we look specifically into the 30s in terms of what was going on in our country back at that point in time. And we look at the birth of a program that blossomed into the Medicare program to help, our aged population. And for the majority of folks that are on Medicare, of course, it is driven by an age-based need that says when you reach a certain point in time, you can qualify for this program that will help provide medical assistance to you. And then, without getting too much into Medicare and Medicaid specifics, you see the big difference, of course, is that Medicare is a 100% federally funded program, and that its directives are more nationally, whereas Medicaid is a partnership between the states, and it is a program that we often hear this statement that when you've seen one Medicaid program, you have seen one Medicaid program. And that is definitely the most difficult point when you're looking at Medicaid fraud, is working within those individual programs. Now, recently, we've seen realignment at CMS under the Centers for Medicare and Medicaid Services, in which they created a new umbrella organization called the Centers for Program Integrity. That is headed up by Dr. Peter Budetti, and many folks in our audience have probably heard Dr. Budetti speak. You know, he recently testified, I think just on June 7th, about some of these issues that we're talking about today. Mm-hmm. And under that umbrella is the alignment of both Medicare and Medicaid program integrity. And for the first time since we've got the programs, we see coordination and communication between the two programs. And what's unique about that perspective is that when you're bringing in these two programs, that is one that is wholly federally funded and one that is based on state and federal funds, you see an alignment that you think at first is like oil and water, and you realize that you can shake it up, but eventually if you let it sit on the shelf long enough, they'll separate. Well, hopefully, this emulsion process that we see within the Centers for Program Integrity will slowly take that and keep it together in a more lasting effect in terms of guarding the programs. And from my perspective, that's what I see in terms of all the states that we deal with and we talk to on a regular basis, is that this emulsion, this process for bringing these two programs, which are often at odds with each other, into a more structured alignment. Dr. Budetti talks about the two pillars that they deal with within this program, and I think those two pillars need to be carried across in a more, I hate to use the word aggressive, but I think that may be necessary, manner for the states to be able to work together with the federal government and then with the Medicare program to help work together in combating both fraud, waste, and abuse issues that seem to be out there and not dissipating.
Mm-hmm. We have I want to go to this question from one of our listeners. It's come in through our chat box. It says, this is from Susan. It says, is there a single database of people who are being watched for fraud?
Well, when you think about a single database, you actually have to ask yourself, are we talking about a single database of providers? Are we talking about a single database of beneficiaries? Obviously, those two parties are the distinct recipe for making or breaking the programs, because that's what we have is our providers and our beneficiaries. When we look at one type of database that's being developed, we look at the existence of the One PI program that is out there that the federal government is working on. Those types of programs are trying to bring in alignment of these program providers, in other words, both Medicare and Medicaid providers, into a structured database that will allow folks to look at that and say, here's my provider base, here's the information for each of those providers, here's the services they do, etc. Hopefully, in the future, again, this is one of those technology things that we will see this program develop in a more timely manner, and one that will have readily access for not only the government, but for our private payers. I think if we are all in agreement that we want to reduce fraud, waste, or abuse in the programs, that we must work together again. Obviously, the plans are very important in this mix, because we have those providers that are in both worlds. And when I see a program like this, it's one of those areas that I think we definitely need more effort from the federal government to produce a quality product that can be used nationally to combat these issues. Now, at some point in time, we do see the development of community health information exchanges. We see the development of all payer databases out there. It would be great if we could all get together at a table somehow and start talking about how to bring these pieces together so that everybody can have an access to keep an eye on it. Now, obviously, the question that we all look at is, well, if we have access, are the bad guys going to have access as well? Because we know we have people that can get into there. And that is one of those weaknesses that we must look at when we talk about risk analysis in these programs. We have to look at the access issues, and we have to look at trying to stay one step ahead of our the healthcare crimes. It's a very difficult battle. As we develop a tool to combat and fight fraud and abuse, and we nail it down and we start distributing that across the country, the criminals, of course, are one step ahead of us in developing another tool to combat that as well. Mm-hmm. So leveraging technology is definitely going to be important, and so I think that question is appropriate. We do need a better system, especially for a provider base.
We have another question from one of our listeners that has come in. I think it's kind of interesting. This is from Ann, who's in Washington, D.C., and Ann is asking the question, the press often reports on Medicaid fraud with huge numbers, but why does it take so long to discover fraud?
Again, fraud is one of those very difficult things. When we talk about law enforcement issues in Medicaid fraud or Medicare fraud, it's not something that can just happen overnight. Usually, yes, there are cases that just pop out and that we're able to tackle, but in most cases, when you look at the investigation process, it's a process that takes several years to get to the point where you can actually convict somebody. For the most part, cases, in terms of looking at fraud, it would be a wonderful world if we could just simply take a snapshot and say that is fraud, intent has been proven, and we're good to go, and we throw it out on the table. It's kind of like the old days when you could take Polaroid pictures instantly, and everybody got excited back then because you'd have a picture automatically. Well, fraud is not that quick. In order to develop fraud and to look at those, you need to have the evidence as well. So that evidence chain is important. But you also have to be able to prove that in terms of saying, is it medically an issue, or is it simply a claims issue? Do you have a medical necessity issue driving that versus a claims issue? And then the differences or the nuances within each state's Medicaid programs can impact that ability to say that is actually fraud, to where you have found the intent of the provider to commit that act. Again, those are difficult areas, but, I don't think we're going to reach a point, even probably within the next 5 years, that we're going to have a much quicker way of determining and then actually proving that case is fraud. We can oftentimes, through the administrative processes within states, determine overpayments or improper payments, and we can deal with those issues. But when you're talking about fraud, again, you're talking about the intent, and then you have the legal system that is going to come into play as well. And that can become a political arena for many programs. In talking with my colleagues across the country over the last many years, everybody faces that daunting task of being able to prove that something is actually fraud, and that intent was a piece. The main piece in that puzzle. Mm-hmm. So that very good question, though.
Okay. Well, I've got lots more, and we've got. This is a subject we could talk about quite a bit. But when we come back, I really want to dig into what is going on and what are some of the very specific things that organizations are doing to combat fraud. So we're going to pause here just for a few minutes before we finish our conversation with Alex. So Please stay with us. We're going to be right back.
I hope you're enjoying today's show, and I want to remind you that opinions and viewpoints expressed by guests on the Medicaid Matters Talk Show are not necessarily those of the host or our sponsors. Thanks for listening, and we'll be back in just a moment.
Every 19 seconds, a child will die because of a lack of clean water. It is estimated that more than 80% of childhood diseases and deaths in underdeveloped countries are a direct result of drinking contaminated water. During the course of this commercial, 3 children will die. You can help make a difference in the lives of these children. By supporting Healing Hands International, you will provide safe, clean drinking water to families and villages around the world. Since 2006, Healing Hands has drilled more than 400 water wells in countries like Haiti, Ethiopia, Zimbabwe, and Honduras. Through the help of people like you, we have been able to bring the gift of clean water to more than 1 million people. To learn more about Healing Hands International and what we are doing to help, visit www.hhi.org. With your help, we can continue this life-saving work and make a significant difference in the lives of children.
Medicaid Matters, the only live and interactive talk show about the business of Medicaid healthcare. We're here every other Tuesday at 1 p.m. Eastern Time. You can join us at MedicaidTalk.com. We hope you'll be a part of the show. I want to thank Jeremy and Susan and Ann, some of our listeners who have sent in some questions to us. Very good questions for our guest today. And if you've got more, you only have about 13 minutes or so to get those in before our show is finished. Alex, I want to talk to you about some of the things that are going on across the country to really attack fraud. I know you have an opportunity to interact with this problem on a regular basis. You look at it from a national perspective. Can you tell us some of the innovative things that you're seeing organizations do to prevent or detect Medicaid fraud?
I think some of the greatest innovations right now are the states that are taking on a more proactive approach in reviewing their data. In other words, whether they're utilizing a commercial product or whether they have developed something within their own systems, being able to do predictive analysis. I mean, that is one of those big buzzwords we hear right now, predictive analysis. But it's that type of proactive stance in terms of looking at your data and keeping an eye on your claims that is going to be one of the forefronts in terms of preventing fraud, waste, and abuse. Another great big area in innovation, of course, is ensuring that your provider base is a safe place for your patients, and also that we report appropriately, states and other agencies, that when we have a bad provider, that we have a mechanism for getting that information put into a system and that it is available for everybody to look at, so that we don't put these providers back on the books. You know, less than 5 years ago, you look at a provider running from Florida out to the Midwest because nobody's following them. They get trapped in one area and they just keep moving across the country. Our ability now to track that person is much better than it ever was. I think we have a lot of room to grow, but that is one of the innovative areas where I think states and the plans, as well as our government agencies and any of the health groups out there that can get together to create a more wholesome database in which we can prevent these providers from coming in the door. Is it foolproof? Probably not, but it's definitely a step in the right direction in terms of getting these providers off the books. I think another great innovation is the ability to start looking at healthcare organizations and the type of care that they're providing to ensure that our patients and the people we're there to protect and serve are getting the services they need, and that they're appropriate services, and they are actually improving the quality and care of an individual. Again, the accountable care organizations that we hear a lot about now, or the quality care organizations that are popping up, and the recent legislation we see in Oregon, bringing these groups together in a more holistic approach is definitely going to be one of those innovative practices. You know, if we look back in time in our recent history, we can look back at an era about 30 years ago when we see a big blossoming of health maintenance organizations, and they've come a long way since then. And I think we're seeing a lot of legislation in the states in which that type of proactive stance in terms of addressing Medicaid deficiencies is a fertile ground for developing processes now that can pull all of these resources into one database, and that we can monitor that care and we can transmit records under an electronic health records environment, and that it's easier for people to follow those patients from place to place. Again, we see a lot of migratory folks within the Medicaid program, and to be able to track them across the geographical area is very important. So I think some of those areas are very good. I see the development of improved data analysis out there. There's definitely a more proactive stance in terms of looking at the type of algorithms that we should be developing to connect those dots and to be able to determine where you see weaknesses in the system. Many of the systems that we see out there were developed using fraud principles, and I use that term fraud in terms of how companies look at it, in the credit card environment or in the financial services, and they've carried that over, that type of analysis, over into the healthcare arena. However, that has its limits as well, and I think what we need to do is we need to look at a universal think tank when we're talking about Medicaid to bring these folks that have the highest amounts of expertise in their areas to think whether or not those analytics that are being used and are being developed are the most appropriate tool for determining fraud, waste, and abuse in the system. Yes. And in joining in communication with the plans, with our other government agencies, I think that is so important, and it's a best practice and an innovation that is an age-old wisdom that talks about being able to communicate with your partners. It is so important and vital in this day and age that there is a better cooperation with law enforcement agencies, with our Office of Inspector General throughout the countries, with the program integrity areas, with the Medicaid policy folks. All of these pieces need to be brought together in order for there to be a good picture of that environment. We're doing a much better job than we have ever done, and we have more support from the federal government. Is it enough? I'm not sure if it's enough. And when I look at it, I say I still see pieces missing on that puzzle, and I think it's important that we start putting those pieces together, because we're at a point now where if we don't, the criminals are going to be that much further ahead of us because they're organizing themselves. We should do the same and organize ourselves in terms of a program. I see all these programs being developed out there, and I think we want to avoid any duplication of efforts. We want to avoid that duplicity because it just wastes time and energy. So when we look at efficiencies and effectivenesses in the system, we have to look at the programs that are out there. We have to look at ways of getting that information, a better way of communicating across these programs, and then getting that point out to as many people as possible to help educate not only our providers but ourselves, because it's very important that as program integrity and people that are trying to improve the system, when we look at healthcare initiatives and healthcare reform at large, that to have the knowledge is much better than trying to find your way in the dark, stubbing your toes all the time, and then tripping over each other. in the end, we often look at the pictures of the Three Stooges and we realize, we can continue in that model, or we can start thinking in terms of this great brain trust we have in the Medicaid arena and Medicare arena, and pulling those resources together in a more holistic manner, one that is going to be able to develop these analytics and to look at systems and to use leverage technology in an appropriate manner that is cost efficient for states and for the federal government.
Why do you think more organizations aren't doing that? Is it just an issue of capital outlay, or are there deeper, maybe organizational, philosophical, or structural issues that prevent a more effective fraud program?
I think we're seeing a combination of many of these different pieces. We look at the special investigations units, and when we talk about SIUs and the plans out there, we see that they have developed and come a long ways over the last 30-plus years. And I think that technology that they have used and the type of organizational structures they've put into place, as well as their policies and procedures, can be shared at a more national level. And that will improve definitely what we determine as the metrics. Oftentimes we're faced with hearing this word of an ROI, return on investment for the dollars in these programs. The federal government has multiple programs in terms of the Medicaid Integrity Contractors, the Medi program, which is a data matching program. We hear about all these initiatives for improving the quality of health care in terms of the Affordable Care Act. And that type of language we see more prevalent. But we forget our managed care partners out there have been doing some of this work for a long time. I think, again, it's, they have to take into account looking at their budgets and determining where they can leverage their resources. But at the same time, if they've got somebody that's right next door to them that's doing the work, why not knock on their door and ask for a little bit of assistance? It's not that they may be able to provide tons of resources, but when you look at it in totality for all the different areas that somebody can get information, it's that ability to pull it all together that is so vital and so important to the success of these programs. Obviously, if a state decides one day to shut down its Medicaid program because it can't afford it, and we see those issues such as in the state of Illinois that had to make huge slashes and cuts to their Medicaid program, do we end up just putting more people at risk? And I think that is probably the wrong direction to go. I think we should leverage the resources we have now, not only at a national level, but within our states as well, and even down to our local and county governments. I think it's very important that we look at these services and the types of products that are being produced out there and determining ways that they will improve our metrics overall.
Well, we just have a couple of minutes left. I've got probably more questions than we could ever get to about this subject because so much is being talked about. And any final thoughts before we go, Alex?
The best thoughts I would have is if folks get on the phone, use what you have out there for access, look at any type of information out there, such as this program as well, to where you can get
90
information
seconds.
to improve your program's performances. And, everybody's just a phone call away. I know we have lots of systems out there, but we're only a phone call away, everybody is, from finding the help and assistance they need to improve their state's metric systems, as well as the federal government. I think CMS can reach out to states as well and open that communication corridor in a more effective and efficient manner.
Yeah, no doubt. Well, thanks for being with us today, Alex.
Oh, it's my pleasure.
60 seconds.
Good. Well, our next show is June 26th. We'll be talking with Karen Dale, Executive Vice President of Strategic Health Solutions at DC Chartered Health Plan. You can get more details about that at MedicaidTalk.com. And also, don't forget to join our community on Facebook. When you like the Medicaid Talk page, you'll get updates, access to contests like the annual bonus that we gave away in January. You can also watch the show live right there from Facebook and network with other people in the Medicaid community. Point your browser to facebook.com/Medicaid Talk. You've been listening to Medicaid Matters, brought to you by Managed Medicaid Services. I'm your host, Richard Yaden, and we'll be talking Medicaid again with you in just a few weeks. So we'll see you then. Have a great day.
10 seconds.